Today on Health Trust TV, we invited to our studio Marlene Bjornsrud from Bosse and Carol Danaher from Santa Clara County Public Health to talk about our programs for active girls and how to get your child to eat healthier. Next, Alana demonstrates how to involve kids in the kitchen, and our main chef, Angie Ong from the Marriott, cooks a tasty and healthy recipe for kids. Later, Dr. Varner gives advice to parents to connect with their teenagers, and we go hard on our abs with fitness expert Ryan Hughes. All this and more on Health Trust TV.
Hi, and welcome to Health Trust TV. I'm Paloma Cano, and today we'll be discussing how a healthy family leads to healthy kids. I'd like to welcome to our studio co-founder of Bosse, Marlene Bjornsrud, and public health nutritionist from Santa Clara County Public Health Department, Carol Danaher. Marlene and Carol, thank you for joining us today.
Thank you.
So tell us a little bit about your program from Bosse.
Well, Bosse was founded in 2005 in my living room with two members of the United States women's soccer team, Brandy Chastain and Julie Foudy, and a number of women's sports advocates who really believe that female athletes have great capacity to be change makers in the world. And we sat together to decide to begin an organization that would take initiative, that would put women athletes into the community to do good work.
Wonderful. So what is Bosse doing for Silicon Valley?
Well, our signature work is that we've created two programs to have women athletes lead children in high-intensity physical activity. One is called Bosse Girls, and it's a way for athletes to lead girls in physical activity that isn't based on sport, but is based on good high-intensity movement for 75 minutes, 1 day a week after school, for up to 65 girls in high poverty communities. The other work is called Bosse Rollers. It's for kids with physical and cognitive disabilities, also led by female athletes that go on to campuses and work with community of children who don't normally have physical activity as a part of their weekly life. And we also use those playgrounds to teach kids with disabilities that they have a place on the playground and they too can be physically active.
So Marlene, how can girls and schools get involved in Bosse?
Well, Bosse Girls is for girls in 3rd, 4th, and 5th grade. So if a young girl hears about Bosse and wants Bosse Girls to come to their program, she should approach her principal, who would go to the Bosse website at bosse.org anytime after May 1st to apply for our program. It is free because we secure support from other great organizations outside of Bosse, so neither the school nor the girls are charged a fee to have a Bosse Girls program.
That's wonderful, and that's Bosse, BAWSI.org.
Exactly. Thank
Great.
you for that.
And Carol, can you tell us a little bit about your program?
Sure. I'm here to tell you about the 5 keys to raising a healthy, happy eater class. And this is a parenting class. And you know, anyone who's ever eaten with a child knows that feeding a child is all about parenting.
Yeah.
And this class came about as a result of just a broad coalition of pediatricians, nutritionists, community organizations who really realized that parents needed help with teaching their children how to be a good and healthy eater. And it's much more difficult to teach a child how to eat than to tell a parent, oh, get your child to eat this or that.
Yeah.
That's simple guidance to do. So we developed this class, the 5 keys to raising a healthy, happy eater. And parents from all over the county come to this class, and many of them come in because their child's a very picky eater. We had one mom who, her 2-year-old had refused since the time that she transitioned to solid foods to eat really anything. And the mom tried to serve her green vegetables and meat and all kinds of food. And this child was just really tough to feed. And so she came into the class. When the mom came into the class, the child was eating pretty much milk, ice cream, a few items of fast food and lots of candy, you know, foods. The mom was desperate. She wanted her child to eat.
Yeah.
And so we worked with that mom so that the mom could be a good teacher. She didn't need help knowing what to feed her child, but how to feed.
Yeah.
And
So you train the parents?
We train the parents, and we work with parents with kids as young as 6 months of age when they start solids all the way into the preschool years, because those are really foundational
Yes.
years. One of the things we do that we're quite proud of is we help moms really be successful with family meal times, because moms like the relationship building that goes on at family meals. And what we hear is that kids may tantrum at meals or may run back and forth to the
Yes.
TV. And so we talk to parents that they have teaching skills that they already have and how to apply those to eating. Because eating is like learning to ride a bike. It needs parents understanding and the right tools. And lots of trust that the child's capable of learning. So I always say that with a picky eater who refuses, say, broccoli after trying that twice, about a quarter of the parents will say, oh, you know, it's not that child doesn't like broccoli, don't give her broccoli. And if you compare that to how a parent might teach a child how to ride a bike, when a child fails after trying to ride a bike a first time, the parent doesn't take the bike away and say, oh, you can't ride a bike.
Yeah.
They just keep trying and have trust that the child can learn. And it's that same type of skill that children need to learn to eat well.
So Carol, what are the 5 keys?
Oh, I'm glad you asked. The 5 keys are 5 unique responsibilities that children and parents have to create this eating environment in which children can learn. And the parents in these 5 keys are responsible for what food is served to the child and what food comes into the house, of course, when eating is allowed, and where eating is allowed. So that what, when, and where provide a very structured routine for children that helps them learn. And children, keys 4 and 5, are the child's responsibility, and that's children are responsible for how much they eat and whether or not to eat from what is served. And what the research shows very clearly is these dual responsibilities of parent and child do allow children to eat the amount that's right for them and helps them learn to like new foods. It is also a best practice model recommended by the American Academy of Pediatrics.
That's wonderful. So both parents and children have a say in what goes onto their plate.
Exactly.
So how do parents in Silicon Valley get involved?
Well, the class is free to every parent. And we do focus on early childhood, but we do have parents of school-age children. And there's an 800 number, and that'll be on your website.
Okay.
And there's a flyer. The class is taught in English, Spanish, and Vietnamese.
Oh, wonderful.
All over the county, from Gilroy up to Mountain View. Every month there's several classes. And so there's always a location and a language that'll meet parents' needs.
So they can log on and look at our webpage to find
Yes,
out
yes.
more information. Well, thank you so much for being here today with us.